When the typhoon hit the Philippines, SEMPER called me to volunteer. At the moment, I said, I'm going. I'm committed.
This is a simple telephone.
I've been to a disaster before and just felt like a calling, like it was time to go.
I grew up there. I was raised there. So it goes to the very core of me.
Does everybody have 72 hours worth of food? We're enormously excited. This is about getting down to work and saying, yep, we've got a real opportunity to do a lot of good here.
I felt an incredible connection to the people of the Philippines that had been so kind to me in my visits to the Philippines before, and wanted to help when the call went out.
You want albuterol for T-meds?
You want my cell phone?
Which two is yours?
These two.
Okay.
And then
We all good?
We know that we're going to do a lot of good, and that's what we've been training to do. This is what we do on a daily basis.
That was very helpful.
Bye.
I don't know what to expect, even I'm from there. So I was very nervous, but on the other hand, I was ready to go.
As we came in on the C-130, you could just see that there was nothing left. It was just flat.
This is my 7th major catastrophic disaster, and every single time you get into a disaster zone, it gives you a different level of humility as a human on the face of the earth.
It brought me to tears. I couldn't imagine what it had been like in the weeks prior, right after the typhoon.
There was so much medical need that it was necessary to split up SEMPER into 2 teams. One team went to Guiwan and the other was in Tacloban.
The performance of the team, getting ready, getting out the door, in country, I couldn't ask for more. It was great.
Each day we have a plan, we have an objective. We started our day at 6 o'clock. We set up clinics each time.
Perfect, that works, yeah, perfect.
We had to make do with putting our surgical unit on one corner, pharmacy on another corner.
By the time we arrived, much of the acute trauma was over. A lot of what we did was primary care. Mixed in with those, there was the traumatically ill, people who had wounds that were now getting infected, people who had severe injuries that had not been treated to this point.
We did what we needed to do, which is help get people back on their feet again. You know, these people lost their houses, they lost their medications. They'd been without care for 3 weeks.
I'm a social worker, so I was a sounding board for many patients with all sorts of situations.
They had so little in the first place. And then what little they had was destroyed, but they were so optimistic.
She's still being treated for tuberculosis.
The Filipino nurses and doctors were awesome. We had no lab tests, we had no x-rays, we had no CT scans, but they really opened their doors to us and gave us their assistance for us to be able to help them. Being able to jerry-rig therapies and come up with ideas and solutions takes it to a new level.
After we got home, seeing the homecoming, seeing the reception, that's when you really start to sink in what you did. And what I realized was it wasn't just the 10 individuals from the institution that went back. It's that we were representing every member of the institution here at the hospital, and we were that extension.
Well, we're so proud of you guys.
Oh, thanks.
The thing that's important to me is being able to say, yep, this is a truly stressful situation, and our group walks in as utterly professional and provides excellent care. And when I look back on it, I say, yes, we accomplished all of those things. And I really believe that getting people good at this makes us better clinicians in the hospital, both more empathetic, but also more professionally capable when the institution is challenged.
When we have a bad trauma now in the emergency department, and one of the nurses that I've worked with in the Philippines is there with me, we have each other's back. We're stronger and we're a better team.
You start to see qualities in people that you work with, and I think you realize that you can stretch beyond what you're doing.
SEMPER taught me how to become a good nurse, a better nurse, become more independent, strong, never stop learning, never stop helping, ultimately being a good person.
It's an honor and humbling to have been able to represent the institution and have this experience.
Okay,